Knock, knock, knock. Hi, my name is Lisa. I'm going to be your student nurse today. I'm going to go ahead and provide privacy, do hand hygiene. Can you tell me your name and date of birth?
Christopher Patterson, 12/31/98.
Perfect. Can I see your scan? Thank you so much. I have an order to do a head-to-toe assessment. Is it okay if I do that today? Okay. Can you tell me where you are?
The doctor's office.
And can you tell me why you're here?
General exam.
Perfect. What's the date and the year?
October 2025.
So you're oriented ×4. You're well dressed. Your speech isn't slurred. Your eyes are responding appropriately. You're responding appropriately with your verbalization. Your motor, your muscle is responding appropriately. So I'm going to go ahead and do your head assessment. Is it okay if I touch you?
Mm-hmm.
Perfect. I'm not seeing any alopecia. Your head is symmetrical. Do you have any headaches?
No.
Okay. Any head trauma?
No.
Okay. I'm going to go ahead and look at your ears. Your auricle lines with your eyes. Your ears pink. Do you have any hearing problems?
No.
Wear any hearing aids?
No.
Okay. Your right auricle aligns with the corner of your eye. It's pink. We're going to go ahead and test your hearing. I'm going to say a color and you can just repeat it back.
Green.
Okay.
Black.
Perfect. Do you have any problems or any chronic eye conditions?
Mm-mm.
Okay. Do you ever have any crust in your eye?
No.
Okay. So we're going to do a test. It's called PERLA. It tests your pupils to see if they're clear, equal, round, if they respond to light, and if they accommodate. So I'm going to go ahead and examine what size in millimeters your pupils are. It's supposed to be within a 3 to 7. Yours is about a 5, which is within normal limits. And so now I'm going to go ahead and see if they accommodate. So you'll just look out here at my pin. And they do accommodate. So now I'm going to test to see if they dilate both directly and consensually. It's okay if I shine the light in your eye?
Mm-hmm.
Perfect. They both dilate consensually and directly. So now I'm going to test, we're going to see your nose patency. So I'm going to have you close each one of your nostrils and breathe. And now you can close the other. Do you get any nosebleeds?
No.
Okay. Any problems with your smell?
No.
Your nose is symmetrical with your face. I'm not noticing any abrasions. While looking at your face, I do notice that your cheeks are a little bit redder than the rest of your face. But no abrasions. I'm going to go ahead and look at your mouth. Your lips are pink. Do you have any problems with your taste?
Mm-mm.
Any false teeth?
No.
Okay. It's okay if you open your mouth for me. Your oral mucosa is pink and moist. Can you stick out your tongue? Perfect. And your tonsil, your right tonsil is a little swollen. Do you have any problems swallowing?
No.
Okay, I'm going to go ahead and feel for your trachea if you'll swallow. Trachea is midline. Was that swallowed okay?
Mm-hmm.
Okay. So now I am, let's see, that concludes your head, ears, eyes, nose, and throat. So now we're going to go into your respiratory exam. So I'm just going to go ahead and look at your hands to check for clubbing and just look at your nails. Do you have any skin conditions?
Mm-mm.
Okay. Your skin on your hands and your nails looks even. Your nails are rounded and I'm not noticing any clubbing. I am going to go ahead and just check your capillary refill. It's supposed to be less than 2 seconds, and it was less than 2 seconds. I'm also, since I'm looking at your skin, just going to check your skin turgor. And it went went down instantly, which is what it's supposed to do. So, do you have a cough right now?
Yes.
Okay, do you cough anything up?
No.
No? Any shortness of breath?
No.
Okay, I do want to just educate you on incentive spirometry and turn, cough, and deep breathe. So in a hospital setting, you'd use those to decrease the chances of getting pneumonia. With turn and cough and deep breathe, you'll just turn, cough, and take a deep breath and cough. And that clears your air passages of secretions. And with incentive spirometry, you would put your lips around this little tube, take a deep breath in, and exhale over 5 seconds to a set goal, and that would just increase your breathing capacity to stretch your lungs to reduce the risk of pneumonia. So now I'm going to go ahead and fill you. Is it okay? We're doing your respiratory assessment. My thumbs need to just go up and separate, which is what they're doing. And when you do breathe, I notice your chest walls will rise and fall equally. So now I'm going to listen. You'll just breathe regularly, and if you feel any pain or discomfort, let me know. Now I'm going to have you rotate so I can listen to your back. Your breathing was clear anteriorly and even. So for the back, I'm just going to have you take a few deep breaths. If you feel any lightheadedness, dizziness, or pain, let me know. To go in, I'll go ahead and do your abdominal before I do your cardiac. So I would start in the right lower quadrant and my client would be lying down. So I'm going to go ahead and listen before I palpate. Do you have any nausea, vomiting? No? Okay. When was the last time that you defecated?
This morning.
Okay. When was the last, do you have any pains when you urinate? Okay. What would you say the color of your urine is?
Clear.
Is there any odor?
No.
Okay. You said it's clear? Is it? Okay.
It's transparent.
Perfect. So I'm going to start in the right lower quadrant. Already hearing vowel sounds, which is what you want to hear. Perfect. And now I'm going to lightly palpate. Let me know if you feel any pain or discomfort, okay? Abdomen is soft, flat. I'm not seeing any discoloration. No bulging. Okay. So now we'll actually do your cardiac. Do you have any chronic heart conditions or take any heart medications?
No.
Okay. So this is where I have my clients recline to a 30 to 45 degree angle. And I'm going to just check for jugular vein distension. So if you look to the left, And jugular vein distension over here. Look to the right. Now jugular vein distension on either side. So now I'm going to start on the right side. I'm going to go to the second intercostal space. I'm listening with my bell. I'm going to listen for the aortic. Now the pulmonic on the left side. Now I'm going to go to the third. This is Erb's point. Fourth, and listen to the tricuspid. And fifth, which is the mitral valve, and also the apical pulse, and I'm going to listen for 1 minute. Apical pulse is 88, which is within normal limits. Now I'm going to listen with the bell. To just listen to make sure you don't have any murmurs. Second intercostal space. This is the aortic. You would still be at a 30 to 45 degree angle. Pulmonic. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid valve. Fifth intercostal space, that's the mitral valve. Also the apical pulse, and you could auscultate for another minute. I am going to go ahead and listen to your abdominal aorta with my bell to make sure I don't hear any whooshing. No whooshing is present. So now that concludes the listening portion. So now I'm just going to palpate your arteries so you can sit back. I'm going to feel for your radial. 2+ regular. I'm going to feel for your left. +2 regular. And now I'm going to feel for your dorsalis pedis. +2 regular. +2 regular. And I'm going to feel for your posterior tibialis. This is +2 regular. +2 regular. I'm going to go ahead and check for edema. I would say there's 1+ edema all the way up to your ankles. I'm going to go ahead and feel for edema on your hands and wrist. I'm not noticing any. Let me go ahead and feel temperature also. Your feet are a little bit cool. Your feet are a little bit cool equally though. Hands. They're warm equally. So let's see. Oh, let me feel for your brachial. artery. I forgot to do that. So you can lean back. Okay, pulse 2 regular. Around there. Pulse 2 regular. Alrighty, so we're going to move into your range of motion. Do you exercise?
Mm-hmm.
Okay. Just a few tips when you're exercising to decrease the risk of pressure injury. You want to make sure that when you sweat, you get that sweat cleansed off pretty quickly, so it reduces your risk. You want to make sure that your nutrition is adequate, and you want to make sure, since you're already active, that is one less thing you have to worry about. So just 3 things to reduce your risk of pressure injury would be activity, adequate nutrition, and reduce moisture as much as possible. So for your range of motion, do you have any pains in your joints or muscles?
Mm-hmm.
Okay. So now I'm going to have you, we'll do one arm at a time. So we're going to extend and then flex. Okay, extend. And now we'll try to do it with resistance. Good. Does that feel okay?
Mm-hmm.
Okay. So now we'll do the other arm. So extend, flex. Okay. Now extend. Perfect. Flex. Great. So now we're going to do our wrist. So we're going to flex. Extend. Perfect. Okay. So flex. Flex. There we go. Perfect. Okay, so now you'll flex. Extend. Perfect. And now extend. Flex. Okay. Alright, so now we're going to do the legs. So I'm going to have you extend, flex. Okay. So flex. And now with resistance. Flex. Okay, perfect. So now I'm going to have you extend and then flex. Perfect. And now with the resistance. Sorry. Okay. Now flex. Okay. So now we're going to point our toes, flex our feet. Okay. Point. And now flex. Okay. Oh, we'll do it with resistance. So point and flex. Perfect. And point and flex. Okay. Point again. Flex. Perfect. Okay. So now I'm going to have you, we'll do the Rumberg test. So I'm going to have you stand with your eyes closed, hands out to the side, and I'll be right here in case you start to wobble. Perfect. Alright, so now I'm going to have you heel to toe walk. So you'll just look straight ahead without looking down, and you'll walk on your heels to me. Okay. I'll actually stand behind you, so in case you start to fall. Perfect. Okay, so now you can sit down. So based on what I said earlier about the reducing the pressure risk, that was based off the Braden scale. The Glasgow scale was your eye responses, your motors or your muscle responses, and your verbal responses. All were up to par, so the lowest would be 3 and the highest would be 15, as in not impaired at all. You scored a 15. Do you have any questions or anything?
No.
Okay, great. Thank you so much.